Hey guys, welcome back to another video. In this video, I shadow a family doctor at a walk-in clinic. Alright guys, I'm here at the clinic and we've seen a couple of patients. I have another classmate with me and we've seen a variety of things. Urinary, some shoulder injections. We've seen we've been able to take patient history. It's really nice because it's calm. It's a walk-in clinic, but so far a great experience. I just got an opportunity to do a physical exam on a young boy who hurt his shoulder, and after practicing for the OSCE for so many hours, I was able to go in there no problem, do a couple of tests, and figure out that his range of motion that's being impacted is due to the supraspinatus. So I'm waiting for the doctor to go and see the young boy and to kind of talk to him about what to do about it. But so far it's been a really neat experience, and I can't show too much because it is a clinic, but the nice thing is that there's not too many patients here, so maybe later I'll take a time to talk more about our experiences. The clinic looks very nice. There's these different rooms. Here's like a operation room, like small procedures. There's hallways, waiting rooms. I have a nice kitchen and all that, and so I'm really enjoying this experience. And the nice thing is that the doctor I'm shadowing is extremely nice. We've had great conversations. So he's currently seeing a patient. I'm waiting to have a conversation with him, bring him in to see the other patient that I just saw, and we'll go from there. All right, it's day 2. We're at the clinic again. Here at 9:30, probably staying until 1. It's a Sunday though, so it's gonna be a little bit slower because yesterday was Saturday. But we'll see what we get. Probably take some more patient history, maybe do some physical exams, and this should wrap up this video. But yeah, it's really neat. I was able to get some clips, so hope you guys enjoy it. So it's very slow, so we're just chatting with the doctor and my other classmate. And so I'm here. I came to the cafe because they have coffee. I'm gonna make myself a quick coffee Keurig and go back there and continue chatting until the next patient, until the first patient walks in.
Oh, yeah, that's what, oh, that feels weird. Oh, I don't like that.
So we found this gadget that you can put in your ear and connects to your phone so you can see what's in your ear.
Oh, that is a weird feeling. No wonder that kid did not like it. Oh, oh, oh.
Does it go far?
Yeah, pretty far. Oh, that's a weird feeling. But yeah, you can see a bit of the light reflex there and just the tympanic membrane. Don't have an ear infection, guys. Yeah, see? Light reflex right there. That's a weird feeling.
What is the light reflex?
Oh, I see.
So you see it right over there. You're supposed to see that if there's no effusion behind the tympanic membrane, and then that's the bony. I can't really see it very well. Oh, that is.
I'm going to try to summarize what happened yesterday and today at the walk-in clinic from my experience. So overall, it was pretty good, but because it was a Saturday and a Sunday, it was slower. But that's not too bad because myself and the other student, we had more opportunities to talk with the doctor, ask him lots of questions, about being a doctor, about certain diseases, how to treat, how to manage, doctor's lifestyle, the paperwork and whatnot. And so in that sense, it was enjoyable. So yesterday was Saturday. A couple things we got to do was a shoulder injection. We didn't do the injection, the doctor did, but we got to see it. The results were like instantaneous. Like we saw where to palpate exactly to then inject, and as soon as the injection was in with the steroid and the anesthetic, the freezing agent, the patient was already able to kind of increase her shoulder past the pain point. So that was really neat to see the change so fast. Another patient that we saw, or that I saw, was an older gentleman with epistaxis, epistasis, which is nasal bleeding. And so what we thought was happening is that he just had dry air in the home and was more prone to having bleeding of the nose whenever he blew his nose, because there's irritation of that skin. And so what the doctor did is looked into his nasal passages, just in his nostrils, and then later we looked at a Google image to see what he was looking at. Basically, it's just in the Kesselbach's plexus. It can get very irritated, and if you scratch that, then it could start bleeding. And so the doctor prescribed put some Vaseline there and maybe another ointment. Another patient we saw was a young 16-month boy, so that was fun. No real problems there. And then I got the opportunity to do a shoulder exam on an 8-year-old who plays hockey. So what happened is, right shoulder pain kind of hurts, and I felt like, okay, I'm ready for this. I prepared for this for the OSCE. So I showed up there, took some history, asked some quick, simple questions to get an idea what he does, and then I did my shoulder exam. So started by inspection, palpation, did active range of movements, and then did special tests because I had an idea, maybe like a rotator cuff tear leading to, possibly supraspinatus. So I asked him to do a drop arm test where he raises arms and then slowly lowers them, and he felt pain in this range. And then I was like, okay, so that seems like supraspinatus. So what's another test I could do? Empty can, or I think it's called the Jobs test. So that one's where you empty the can. I added some pressure on his arms and he felt pain on the right side. I was like, okay, well, that seems pretty solid. Got the doctor and he just prescribed physio. So that's pretty much it for yesterday. And then today, I went back in around 9:30, 10 on Sunday. And again, it's just a walk-in clinic. So we had a couple of patients, but the biggest, the coolest experience here is, because there aren't too many patients, we're able to really have a dialogue with the doctor and ask him questions and learn from him. And we had a patient come in with a shortness of breath, felt a little bit of like a panic or anxiety attack. And what happened is, we listened to her, we took her history. My classmate and I took a very thorough history, which is very helpful. Then we listened to her lungs with our stethoscopes with the doctor, and we noticed a little bit of like a wheezing. So it makes sense, history of asthma, possible allergens, a little bit of a rash. And so what we ended up doing is the doctor was concerned, so he gave her inhaler right on the spot. So she inhaled, I don't know what kind of inhaler, I think it was like a budesonide with formoterol, and came back after 10-15 minutes, still, made minor improvements. So what we did is use a nebulizer to mix an anticholinergic with a beta-1 agonist so the anticholinergic decreases secretions in the lungs, and then the beta-1 is a bronchial dilator, so that helped open up her passages so she could breathe better. And after another 15 minutes of inhaling those chemicals, she felt better, she could breathe better. We listened to her lungs again with the stethoscope, and the wheezing that we heard was improved. She still had wheezing, but it improved. So it's really neat to see these cases where you notice the patient improve right in front of you, because that's not always the case. So when it is, it's like the cherry on the top to be able to be part of that. We had another MSK injury, so a young lady who jogs a lot came in with a little bit of pain on the lateral side of her foot. So I did an ankle exam, palpated her feet, located where it hurts, told the doc. We went in there and, you know, we were thinking, you know, possibly not a sprain, possibly like a small, a stress fracture, or just repeated trauma due to jogging a lot. So again, we ordered x-rays to make sure to rule out those possible sign of a stress fracture. And lastly, I finished off with doing like a phone consultation. So hopped on the call with a patient, asked questions about rashes, and that was pretty solid. I took down notes, so while we're shadowing the doctor, we have to take down notes, or we can, what we call SOAP notes, subjective, objective, assessment, and planning, I think. And so I was taking down notes, and for rashes, I just wrote down, patient has red rashes. And then when he looked at my notes, he laughed. And because in dermatology, red rashes could be anything. So he calls them like rashy rashes. Because it could be, you know, in dermatology, it could be more specific, macular or papular or abscess, whatever. But we haven't covered derm, and so I just wrote red rashes, which is super broad. So we laughed at that. But yeah, the clinic, you know, the clinic and the location itself was very nice. I really enjoyed being there, and I would love to work in a clinic that is similar. In the morning today, I had some coffee, very relaxed feeling, just sitting back, asking the doctor questions. We tried this otoscope. It's like this small otoscope. We looked it up. It was like 26 bucks. But another doctor had it. He just grabbed it from our office, and you basically put the instrument in your ear, and you could see it connected to your phone and see what's in your ear. So we did that with a young patient who had a little ear pain, but she was like 7 or less, and so we weren't able to see clearly. But yeah, that was interesting. So that's it for my preceptorship experience for now. We only had 2 sessions to do with a family doctor. The next time I'll be in a family clinic, if we're not allowed to because of COVID, will be in clerkship, and I'm scheduled for like February, April. So that's next time I'll be able to shadow a family doctor. Until then, take care, guys. That's it for this video. I hope you enjoyed it. If you like this video, then you're definitely gonna like this one.